All right, Jeff, thank you very much. New this morning, in the fight against COVID-19, we talk a lot about the nurses and doctors on the front lines, as we should.
Absolutely, but there's another group of healthcare professionals who are a vital part of the team and who might not always get the same recognition. I-Team reporter Kat Reed introduces us to some unsung heroes.
When we talk about the heroes inside hospitals,
everybody's familiar with what a physician is, a doctor. Everybody's familiar with what a nurse is and what a nurse does.
But they're not alone on the front line of COVID-19.
RTs are the ones there too. We are at the bedside too. We are there in that critical care setting with everyone.
We like to say respiratory therapists are with you with your first breath, and they're there with your last breath.
They're the guardians of this crucial piece of equipment.
When it comes time for you to be put on a ventilator, a breathing tube has to be inserted. And a respiratory therapist is that right hand, if not that individual that is inserting that breathing tube.
A respiratory therapist enters settings on a ventilator, ensuring the machine is breathing for the patient.
And adjust things like the oxygen percentage you're being given while you're on the ventilator, the rate at how quickly you breathe, the amount of air you're breathing, the pressures that you're breathing in.
The COVID-19 pandemic is highlighting a problem that predates it, a national shortage of RTs.
We show that the numbers of respiratory therapists entering the field are declining at a rate of about 4 to 7%. The demand shows that there's going to be about a 28% need.
The National Board of Respiratory Care believes the lack of awareness of the profession is to blame. That's why they've launched a new campaign with therapists around the country calling for more RTs.
Being able to help someone breathe or make their breathing easier is the most rewarding thing. I can't even describe, I don't think, how rewarding that is.
I'm going in on my off days just to support my team and be there for my patients.
And are really using it not only to create awareness, but also to thank respiratory therapists and make sure that the world knows that they are kind of the unsung heroes and what they're doing on a daily basis, not only now, but in the future.
A profession playing a vital role in the fight against COVID-19.
We are the ones that help keep you breathing.
Reporting in Kansas City, Kat Reed, 41 Action News Today.
Respiratory therapists have either been associates or a bachelor degree in respiratory care. They have to pass credentialing exams and then apply for a state license as well.